medicine called Meftal, which is a commonly used painkiller known for its effectiveness in alleviating menstrual cramps. And it has come under the scrutiny of the IPC. The IPC, an autonomous body under the Ministry of Health dedicated to ensuring the quality of drugs in India, has issued a drug safety alert on Meftal. This advisory urges healthcare professionals and patients to remain vigilant for potential adverse reactions associated with the use of Meftal. Now, this alert, which is dated 30th of November, is based on a preliminary analysis of adverse reactions reported in the Pharmacovigilance Program of India database. Now, the findings have linked Meftal to symptoms of concerns like fever, facial edema, and extensive skin rashes. In more severe cases, individuals may experience heightened symptoms such as lymph node swelling, hepatitis, and abnormalities in blood and blood cells. And this is why we should all be concerned about it. Joining me on the broadcast to discuss more on this is Dr. Sandeep Nayar, Principal Director and Head Respiratory Department at the BLK Max Super Speciality Hospital of Delhi. Dr. Sandeep Nayar, good evening. Thank you very much for joining us on Mirror Now. First of all, help us understand, Dr. Nayar, in very simple language, what the government has alerted all of us about when it comes to Meftal, the painkiller, which is, by the way, very commonly used not just for menstrual cramps. It is also used for, rheumatoid arthritis, osteoporosis, and such diseases. But a lot of women I know also use it. So help us understand what the government has really said about this painkiller.
Meftal basically contains salt, which is mefenamic acid. And we have a combination, for example, for the females which are using for the dysmenorrhea or the menstrual cycle is a combination with the dicyclomine. Or if you or other patients can also use it when they've got a very high grade fever. So another combination of mefenamic acid comes with the paracetamol. So when you're using this particular salt, it is basically, you don't have to use it just drop of the hat, because this is a very, very serious medication, which you should be very careful, because this mefenamic acid can cause bleeding in the stomach. It can cause, then the patient make vomit blood. It may even cause bleeding in the urine, so hematuria, what we call it. It can cause headache, or it can cause a severe reaction, what is known as DRESS syndrome, DRESS, D for drug reaction with eosinophilia and systemic symptoms. So this is also, they have seen it quite common with this Meftal is a trade name, I would say, about mefenamic acid. So mefenamic acid is not that easy drug or light drug to be taken off, because what happens when we have a high grade fever, we just take out a pill, and we, if the paracetamol is not working, we step up the medication. And many of them then step up to mefenamic acid. Now, even the females who have got a small, got a pain during the menstrual irregularities, they also keep on taking a lot of these medicines, which is supposed to be a very harmful. So what we were talking about, the DRESS syndrome, there you have a drug reaction, you have got a swelling all over, swelling of the face, you can have swelling of the eyes, you can have edema all over, edema is swelling again. And lymphadenopathy, what you mentioned is about the swelling of the glands, which can be very painful. So this medicine should not be taken as frequently as people are taking it.
Dr. Nayar, let me then also ask you, what is the alternative that one should have? Menstrual cramps are painful for women, osteoporosis, rheumatoid arthritis, all of these are concerns. If not painkillers like Meftal, what is the alternative then for all of us?
So let me honestly tell you that all these painkillers, they affect the kidneys as well as the stomach. It can cause gastritis or the bleeding from the stomach, but it can also cause the kidney problem. Now, the safest among them is a paracetamol. You can even take a higher dose of acetaminophen or paracetamol, which will help you alleviate the pain. Though, you can take any painkiller, like even Meftal for that matter, but the frequency of it can really cause harm. The safest among all of these remain to be a paracetamol. Even a higher dose can be very safe when you can take it. Of course, no drug is absolutely safe when we come to allopathic medication, but at the same time, among them, safest is paracetamol.
Dr. Nayar, we have a lot of concern about the fact that we're becoming immune to drugs like painkillers, to antibiotics, because of the kind of overuse we have. At the drop of a hat, we start taking a medicine, we pop a pill. Perhaps because of the lifestyle that we have, we need to get back on track as soon as possible, and therefore it's more convenient to pop a pill and join work back. Uh, but in your experience, I'm sure you meet a lot of people, you see a lot of patients. How high is this concern of immunity from painkillers and antibiotics, and therefore why should we, as soon as possible, stop this overuse?
Absolutely. I think this is a very important point which you picked up because see, it's a stressed life. We are all working, we are all running. So you just pop up a pill if we're having a little bit of pain or even a headache or a myalgia, and you just pop up a pill so that because we can't even afford to take a leave, many of us. So the life has become like this,
Yeah.
and unfortunately, without even thinking about the side effects, these medicines are taken so frequently and even a small infection, or not even a bacterial infection, a small simple cold, you just start taking antibiotic. Where most of the cold is because of the virus, where the antibiotic is not at all required. But just without even taking a prescription from a doctor, and unfortunately, many of these medication are available OTC over the counter, or just go to a chemist, and many times you get these medication without prescription, which is very unfortunate. And you tend to take it very often. And many of them will come to say us and say, "Sir, last time it worked, so probably this will work again." Without thinking that last time it could be a bacterial infection, but this could be a viral infection this time, or maybe not infection this time. It will maybe just
Hmm.
myalgia or little bit of body ache. So please, my request to each and everyone
Hmm.
that don't take it so frequently, any medication. Please ask your physician, or please consult any physician, any expert before you take it, because this medicine, of course, can give you a short-term relief, but in long term, it's going to affect each and every part of the body.
Hmm. Okay, my last question to you, Dr. Nayar. Here in India, we rely a lot on our traditional systems of medicine, Ayurveda, Unani. All of these are also taken into consideration along with allopathic medicines. Is there a natural way of reducing when we are in pain, when we have menstrual cramps or other kinds of pain, instead of popping a pill, popping a painkiller? Are there natural ways to go about it?
Absolutely. See, I have got all the respect for other pathies also. I'm an allopathic trained doctor, but I have all the respect for homeopathy, Unani, and Ayurvedic, because they also have a science behind it. And many of them, the Dadi Ma ke nuske can work. And most of the pains are
Hmm.
can be corrected on its own also. It's just a matter of time. You may experience a pain at times, and after some time that pain might go on its own. You just have to divert your attention. And even the menstrual pain or other pains, which can be at times really distressing. And if you take a little bit of, something to ease you, or maybe just listen to a music, or just divert your attention, you will definitely get better. So my request to everyone is that straight away going and popping our pill, let's try to these things if possible. It might not work always, I admit, but it will work most of the time. And I think we should also improve our lifestyle. This stressed life, running every day, not sleeping well, not eating good, nutritious food, they can all cause all these problems. So I think if we take a good, nutritious food, hydrate ourselves, exercise a bit, a good, healthy lifestyle, we'll be not needing most of the pills as we are needing it now.
When do we know, Dr. Nayar, when do we know that we should take a medicine? Till the time the pain is bearable, or when is that point where we should give in and we should take a medicine as a painkiller?
So these people who have got chronic illness, for example, we were talking about osteoporosis, or rheumatoid arthritis, where the pain is chronic, you need to have these medication. But again, you consult your doctor. Now we have got many disease-modifying medication also, where they modify the disease so that you don't even experience the pain. At the same time, if the pain is unbearable, of
Okay.
course, then you have to take it, because you don't want to just carry on with the pain itself. But again, please consult your doctor.
Yeah.
because he may give you a good alternative for these strong painkillers. For example, this mefenamic acid, what we are talking about, it's a serious medication. We don't have to take it at the top of the head. So please, there will be many other
Mm.
places or many other ways to alleviate your pain, and there will be a better things in other pathies also, with due respect to other pathies, in which we might have lesser side
Okay.
effect. They may be slow acting at times, but they will definitely help you. So for those people who are suffering from chronic illness, please
All right.
don't leave the medication if you feel better without the consultant or the physician tells you. Many times, you feel better, you stop the medication,
Mm.
and then the pain might come back in a very bad, severe
Yeah.
forms. So if you are for any chronic illness, any medication is been prescribed, keep on taking it until your physician tells you not to take it, because there may be a milder form of the medication for which
Okay.
you may not require a stronger medication.